Okay, guys, I'm gonna show you how to know the lower limb blood vessels or arteries in a way that you're never gonna forget it. And I know that you're not gonna forget it because I was taught by the best vascular surgeon ever. Okay, so let's start with the basics. Okay, so obviously we start with the aorta, okay, and then the aorta bifurcates into the common iliacs, okay, right and left common iliacs, which bifurcate into the internal iliac and the external iliac. And internal iliac is also called hypogastric artery, okay? So external iliac, wait, hold on, I'll show you guys. Okay, so external iliac, when it passes the inguinal ligament, it becomes the common femoral artery, okay? And you guys can see the common femoral artery. It's between the anterior superior iliac spine and the pubic symphysis, okay? So yeah, okay. Okay, so now we're at the common femoral artery. That's easy, right? Okay, now the common femoral artery breaks into two arteries, okay? The deep and superficial, okay? So the deep, let's start with the deep. Okay, so the deep is lateral, okay? So it's on the lateral side, and you're gonna see it's on like CT, angios, and things like that. You will see that the deep femoral artery is on the lateral side, okay? And it has lots of branches. So it's gonna be the one that has a lot of branches. You'll be able to know, oh, okay, that's the deep femoral artery. And why does it have a lot of branches? Because it supplies the thigh. So it like supplies all of the like the upper the thigh, okay? Whereas the superficial, it supplies the leg, okay? So lower down. So that's why on CT angios you're gonna see like a long highway kind of thing that's called the superficial femoral artery, and it has no branches, and then the deep one which has a lot of branches and it's on the lateral side, okay? And we can see that here. So this is a CT angiogram, and you can see that this is the common femoral artery, okay? So you can see this is the common femoral artery, okay? And you can see that, hold on. Oh, okay. So you can see that, okay. So you can see this is the common femoral artery, and it bifurcates into two. You can see the lateral over here, okay? It has a lot of branches, and you can see on this side as well. See the lateral one, it has branches. It has a lot of branches. Whereas the medial one, it's the superficial one, and it's more like a highway, okay? And it keeps going down, okay? And then you can also see it here on this CT angiogram, the common over here, the common, okay? And then it bifurcates into lateral and medial. The medial one is more like a highway with no branches, and that's the superficial one. The deep one, which goes laterally, it has a lot of branches, okay? Yeah, and then you can see here, it's like supplying the bones, okay, the femur, which is the deep, okay? So now we're done with the thigh part, okay? And now we're gonna go on to the leg. So as the common, or as the superficial, okay, hold on. Okay, so as the superficial femoral artery keeps going down, it turns into the popliteal artery, okay? So when it reaches the knee, it becomes the popliteal artery. And now from the popliteal artery, there's gonna be three main branches in the leg, okay? Three main runoffs, okay? The first one is the anterior tibial artery, okay? And you can see that it branches off on the lateral side as well, okay? Just like the deep the deep femoral artery, okay? This is the first branch that comes off, okay? And you can see that it kind of goes far off from the popliteal artery, and this is because the popliteal artery, we can feel it as a pulse right in the back of the knee. So this is posterior, whereas the anterior, it has to come to the front, right? So that's why you can see this kind of it's kind of like it goes far off from the popliteal artery so that it can come to the anterior side, okay? And you can see that on this CT angiogram where, so here you have, hold on, so here you have the popliteal artery, right? And then here you can see how it juts out. And you can see over here as well how it juts out. And it's lateral, it's on the lateral side, okay? So see, you can see the anterior tibial artery continuing on the front, like on the anterior side, and it ends up where? In the dorsal pedal pulse area, right? So that's why the dorsalis pedis pulse is it comes from the anterior tibial artery, okay? So this is the anterior. So this is one branch, okay? So we're done with one branch. Now let's look at the other two branches. So if this is the anterior tibial artery, so this thing, hold on, close. Oh, okay. So this part is now the tibioperoneal trunk, okay? The part that is not the anterior tibial artery anymore, okay? And it branches into two things. It's called the tibioperoneal trunk. So what it's going to separate into a tibial artery and a peroneal artery, right? So the second branch is going to be the posterior tibial artery. So we know that there's an anterior tibial artery. So if there's an anterior, obviously there has to be a posterior, right? Anything anterior something, there has to be a posterior something for it, right? So this one is going to be posterior tibial, and notice how it's on the medial side, okay? Medial side, so it branches off on the medial side. So the pulse at the end of it is going to be on the, where is it going to be? It's the pulse that's behind the medial malleolus. And you can see that over here. So see how, okay, so here is the popliteal artery, right? This branching off, this artery that juts off is the anterior tibial, right? And then this is the tibioperoneal trunk, right? And the medial side over here, this is the posterior tibial artery. And see, it ends off over here at the pulse where it's like behind the medial malleolus or at the medial malleolus, okay? So this is the other one. And you can see over here, dorsalis pedis, where does it come from? It comes from the anterior tibial, okay? So this is the second one, posterior tibial, which is medial to this artery now, okay? So the final artery that comes straight down is the peroneal artery, okay? Because tibio-peroneal. Tibio is this one, peroneal is this one, right? Okay, so peroneal artery, obviously, okay? So yeah, that's it. And this is gonna help you read CT angiograms as well. So if we try to find all of the arteries here, we'll be able to read this CT, right? So this is the abdominal aorta, obviously, and then common iliacs, right and left. And then over here, the branching things, we can tell that this is the internal iliac, and the part that continues is the external iliac, and then where the inguinal ligament is, it's going to become the common femoral. And then over here, you can see these like branches. This is going to be the deep femoral. The highway that continues is the superficial femoral, and then when it gets to the knee, it becomes the popliteal, and then this artery that kind of juts off is the anterior tibial, and then this is the tibioperoneal trunk. And then you can see over here this medial one. Okay, wait, hold on. So see how this is like going straight and ends? This is the peroneal. The one that kind of branches off and then comes like this. And over here, there's like a pulse. This is the posterior tibial. And that's it. It's so easy and you'll never forget it, and you'll be able to tell which is which on a CT. And inshallah you get all the questions on this in OSPEs, right, and in other exams, and in clerkship when you come to the hospital as well. And yeah, I just want to end by thanking Dr. Ahmed Sadiq. He's the best vascular surgeon. He taught us all of this. And if you ever rotate in vascular surgery, always go to him because he's going to teach you so much. And yeah, enjoy, guys. Thank you for watching.